If there is one thing you could do to improve your health, resistance training should be the top of your list. In fact, resistance training has so many benefits that it can be said that it is like a miracle medicine. Keep watching to find out why. Welcome to my YouTube channel, The Healthy Drive. This channel is about your health. Here we discuss all about your non-communicable and metabolic health issues which can be addressed not by medication, by lifestyle changes. Not long ago, muscle building was the activity known as weight training, was generally considered to be the domain of exceptionally strong men who competed in sports like powerlifting, bodybuilding, athletics and wrestling. It was obvious that these athletes required high level of strength and muscularity to excel in their chosen sport, and their physiques would respond favorably to heavy resistance training with barbells and dumbbells. The average individual saw no reason to engage in weight training, and participants in other sports typically felt that lifting weights would actually hinder their athletic performance. But as our lifestyle became more and more sedentary and heart disease became the leading cause of death, regular exercise was promoted and prescribed for attaining medical fitness, attaining desirable body weight, and for cardiovascular health. However, the overwhelming emphasis was on aerobic activity like running, cycling, jogging. There was little encouragement for resistance training. But despite a vigorous, sustained aerobic endurance exercises, as I said, like walking, jogging, running, cycling and swimming, which was done sincerely by the people, it has not prevented the incidence of lifestyle diseases like obesity, heart disease, osteoporosis, loss of muscle and mental depression as we grow older. One reason is that you must first get your nutrition right. Otherwise, no kind of exercise will work. It is true that you cannot outrun or out-exercise a bad diet. If you are eating processed junk food and drinking alcohol and having a bad lifestyle, then all bets are off the table. Nothing is going to work. But as far as exercise is concerned, focusing on muscle health has been a very recent realization. Muscle mass actually declines with age. If you are 30 plus, then your muscle mass declines between 3 to 8% each 10 years, that is each decade. And if you are 50 plus, the muscle mass is 5 to 10% each decade, averaging approximately around 400 grams per year, that is 0.4 kg per year after the 5th decade of life. Skeletal muscle, which represents up to 40% of the total body weight, influences a variety of metabolic risk factors like obesity, dyslipidemia, type 2 diabetes and cardiovascular disease. So muscle tissue is the primary site for glucose and triglyceride disposal in the body. So if you lose muscle, you will increase the risk of glucose intolerance and associated health issues. Muscle protein breakdown and synthesis largely are responsible for energy expenditure in the resting state. When you are resting, your muscles are also contracting. Consequently, muscle loss is the greatest contributor to age-related decline in resting metabolic rate, which averages 2 to 3% per decade in adults. Because the resting metabolic rate, or RMR as it is known as, accounts for 65 to 70% of your daily calorie use in sedentary men and women. This reduction in muscle mass and resting metabolic rate may be accompanied by increase in fat. So if your RMR decreases, your fat in the body might go up. So how can you stop this muscle loss and prevent it from happening as you grow older? And in anybody is the question. The answer is resistance training. Now, what is resistance training? Resistance training is a form of physical activity that is designed to improve muscular fitness by exercising a muscle or a group of muscle against external resistance. Resistance training is any exercises that causes the muscles to contract against an external resistance with the expectation of increase in strength, power and hypertrophy and endurance. The external resistance can be dumbbells, or it can be exercise bands, resistance bands. It can be your own body weight, it can be bricks, bottles of water or any other object that causes the muscle to contract. Now, it is true that almost anyone can do resistance training. Age is not a barrier. If any medicine can do what resistance training can do for you, it would be like a miracle drug, as I said. Now, let's have a look at the various way how resistance training helps. Number one, it helps in reversing muscle loss. Numerous studies have demonstrated that relatively brief sessions, that is 12 to 20 of total exercise sets, each exercise set containing of 10 reps or 12 reps, and done 2 to 3 days in a week, can increase the muscle mass of adults of all ages, even up to the 10th decade of life. Many of these studies have shown that lean mass weight gains of about 1.4 kg after 3 months of resistance training. A large study done, I have left the link below, of in more than 1600 participants between the age of 21 and 80 years revealed that a mean lean weight increase of 1.4 kg after 10 weeks of resistance training. And they were doing 12 sets of exercises per session, and they found that there is a increase in lean body mass weight of 1.4 kg after 3 months. Number two, resistance training can recharge your resting metabolic rate. Resistance training stimulates increased muscle protein turnover and actually has a dual impact on resting metabolic rate. First, as an acute response, that is first thing that happens, that it causes tissue microtrauma, and that requires relatively a large amount of energy for remodeling, for muscle remodeling, that is. And this activity persists up to 72 hours after the training session. Now, research has shown that the RMR remains high up to 7% per day, even after several weeks of resistance training. Second, as a chronic response, what happens is resistance training results in a greater muscle mass, which will use up more energy, and it will not only that, it will use up more energy at rest for ongoing tissue maintenance. A 1 kg increase in muscle mass can raise your RMR or resting metabolic rate by 20 calories per day. Number three, it can help to reduce body fat. Resistance training has been recommended in the management of obesity and metabolic disorders. Increase in lean mass results in reduced fat tissue. Resistance training also reduces abdominal and visceral fat. Increased metabolic rate seems to be the major factor. Resistance training also improves insulin sensitivity, and along with a low carbohydrate diet, it can maximize fat loss. Number four, it facilitates physical function. Now, aging is accompanied by a gradual reduction in physical function that negatively affects the ability to perform daily life. As you grow older, you become less active. Now, resistance training can reverse some of these debilitating effects associated with inactive aging, even in elderly individuals. In one study, even 90-year-olds of an old age home demonstrated 60% of overall strength increase in addition to increase in muscle mass. Once again, I'm leaving the link of the study below. You can go through it. Resistance training also addresses metabolic disorders like type 2 diabetes. It improves cardiovascular health. It also brings down your blood pressure if you are a hypertensive patient. It improves your lipid profile. And most important thing is, it can increase your bone mineral density, BMD as it is called. Now, osteoporosis is a huge problem. At present, 61 million people in India are osteoporotic, and more than 80% of them are women. What does it mean? It means that every 1 in 5 of the Indian population is osteoporotic after a certain age. The peak age of osteoporosis occurs in our country 10 to 20 years earlier than in Western countries. Now, this topic is so vital and so crucial that I will take it up in a dedicated episode. But it is important to know that medicines are of not much use over here. Bone strength and muscle strength are intimately related. If you lose muscle as you grow older, your bone strength will also go away. Because the bone is a very dynamic thing. It's not a static piece of calcium. Only the right kind of nutrition and resistance training can prevent osteoporosis to some extent. Once again, resistance training is not only crucial and of vital importance, it can be a lifesaver, because the osteoporosis can lead to pathological fractures, and then the decline in health is very, very steep. Another thing which resistance training can do is to enhance your mental health. Growing old results in loss of self-esteem because of many reasons. One of them being a loss of mobility and physical disability. Now, if you lose your mobility and become disabled as you grow old, this can easily lead to depression, which is a serious issue. India is one of the countries with the highest rates of clinical depression. Resistance training has been shown to not only increase physical but also mental well-being. In as early as 6 weeks of training, studies have shown that the marked reduction in depression occurs in 80% of patients. So it is just like a miracle medicine once again. Another thing which resistance training does is reverse your aging factors. When you grow old, every cell in your body grows old. The cellular powerhouse known as the mitochondria inside your cell becomes dysfunctional. That is one of the causes of, we say, natural aging. But the good news is that resistance training has been shown to reverse this effect and increase the oxidative capacity of the muscle tissue by recharging the mitochondria. So do you want to stay young? Then start doing resistance training today. So if you want to have a look at the whole thing, resistance training is effective in enhancing several important aspects of your physical and mental growth. It prevents and reverses muscle loss. Number 2, it prevents and reverses bone mineral density. It reduces your body fat. It addresses your metabolic health issues like obesity, type 2 diabetes, blood pressure and lipid profiles. It reverses aging factors like the mitochondria and helps to stay physically and mentally fit. And these benefits are universal across all age groups. So there is absolutely no reason why you should not start doing resistance training from today itself. If you want detailed guidance about resistance training and hands-on personal help how to do it, then please email me or send me a direct message on any of my associated media handles, any of my social media handles. Please do not forget to subscribe to this channel and share this vital information with everyone you know. And I'll catch up with you in the next one.